This is the story of the enthusiasm of a young man worried about the increasing amount of tuberculosis amongst his colleagues and the steps initiated by him to relieve the less fortunate members of the community. Just over 50 years ago, Charles Garland, a telegraphist and the CTO of the GPO, conceived the idea of forming an organization with the object of providing sanatorium treatment. Charles Garland, then young and very junior, felt that if his colleagues would pay a penny a week into a fund, there would be enough money to provide treatment for those of his colleagues who unfortunately got tuberculosis. The idea quickly caught on. The Post Office Sanatorium Society was formed, and at the end of 2 years, 250 acres of land were purchased at Benenden in Kent to build the first and only post office sanatorium. During the following years, the society made steady progress, both in the treatment of patients and enrolling new members. Membership of the society was at first confined solely to staff of the post office, but in 1926, membership was thrown open to the whole of the civil service, and today the society is represented in every department in its aisles and covers every class, industrial, non-industrial, permanent or temporary. The society is now known as the Civil Service, formerly Post Office, Sanatorium Society. Today the society has a membership of upwards of 290,000, who with their wives, children and dependents represent 880,524 people covered for tuberculosis and cancer benefits. Despite all these additional benefits, the subscription is still only a few pennies weekly. The society is run by a committee of management. All the officers and trustees are serving or retired civil servants. This committee is elected biennially, and their job is to carry out the society's policy. At the headquarters in London, the staff keep all the records of members and patients. It is a flourishing society, active and up-to-date, keeping pace with every new discovery and every new invention which can help in the battle against TB and cancer. Funds are used all the time to make sure that members who become patients get the benefit of the very latest knowledge and the finest equipment. No effort is spared to ensure that the members have every chance to fight these dreaded diseases successfully. So let us see what happens when a new patient is discovered. Often the trouble is diagnosed when the member takes advantage of the society's free consultant service and sees the society's specialist at his rooms in Harley Street. But generally, the trouble is diagnosed by the member's own doctor under the National Health Service in the course of a routine visit. Or if the doctor suspects there may be something wrong, he does a check on the early symptoms at once. And if cancer or TB are present, he advises the patient to contact the society. In the case of TB, it is nearly always the X-ray photograph which shows up the telltale signs. So an X-ray is always a wise precaution if the condition is suspected. This is a typical photograph showing how TB has attacked the victim's lungs. This is the critical moment when immediate rest and medical attention are essential if the victim is to be cured, and the society take over at once. There is no waiting, no fuss, no delay, and it is wonderful to record that of all the members who get TB, 97 out of every 100 recover sufficiently to enable them to return to full employment. The patient is taken at once to the Society's Chest Hospital at Benenden, so that the doctors can study his case and decide exactly what treatment is necessary for him. The sooner the trouble is tackled, the more chance the patient has of a speedy recovery. Members of the staff at Benenden meet the new arrival and take charge of him and show him his new quarters and settle him in his new surroundings. In the well-furnished and beautifully decorated rooms, the member will be able to relax and meet his fellow patients in comfort and security and learn all about the life at Benenden. The setting for the buildings is one of the most beautiful in the Weald of Kent. The 250 acres of ground are a pleasure to live in and relax in, the knowledge that every attention will be paid to health. The new patient is soon shown round by others who are already established. This is a self-contained community, providing for itself all that is best from its own resources. In the grounds are being developed farms and gardens to supply enough fresh vegetables, fruit and milk to feed all the patients in the hospital. Not only does this ensure good food, but it provides an additional source of interest for the patient. There is always something of interest going on down at the farm, or if you enjoy the countryside, you will not find a more peaceful spot than Benenden. The cooks in their well-equipped kitchens make sure that the food is first-rate and that meals are always welcome. The new patient goes under the immediate care of the doctor, whose medical facilities are complete. The treatment laid down for any individual case may vary, but however slight or serious this may be, Benenden has the best possible facilities and equipment to deal with it. Additions, improvements and new equipment costing £250,000 have recently been installed. An operating theatre equipped for all major or minor operations so that patients needing surgery can be cared for on the spot and immediately. And a new X-ray unit, the latest of its kind. But medical surgery is not enough for the treatment of tuberculosis. Treatment is almost always a long, slow business, and obviously patients must have plenty to do to keep them interested and alert. They will not be able to make the best progress if they are bored or unhappy, or if they are worried about themselves or their families. At Benenden is a new and very fine concert hall where all year long there are concerts and plays and film shows. Many of these performances are given by the dramatic and musical societies of the various departments of the civil service. This is just one of the ways that help the patients to realize that they are still in touch with the world. The patients have themselves formed their own clubs and societies and get up their own entertainments from among themselves. They have their own social circles and they compete in every type of game. Indoors they play tombola or billiards, outside bowls or other games. They even produce their own magazine, and as a humorous comment on the fact that they have their temperatures taken so often, they call it the Rising Mercury. There is certainly no need to be bored or dull at Benenden. Whatever your interest, you can carry it on here. If you have a hobby, you can practice it to your heart's content, or if you want to learn a new craft or trade, there is a wonderful occupational therapy unit to help you, and it does not matter if you have to stay in bed. Most of the activities, from games to basket making, are available to those in bed as well as those who are up and about. Altogether, the Society's hospital is a complete world on its own. Down at the local shop, in the grounds, nurses and patients can buy anything they need. The grocery department is always popular. The manager is a busy man. They even have their own post office, which helps them to keep in touch with the outside world. The staff all live on the premises in fine quarters. There is a lovely nurses' home, and special training is carried on for them. Every facility for rest and relaxation is provided. The staff is complete for every job, and they are all devoted to the fine work they are doing, and like the patients, they keep their spare time well occupied with leisure activities. And after treatment, the Society provides for convalescence. At York Lodge in Seaford, the recovered patient is allowed to get back his strength and have a real holiday before resuming normal life. After a rest at the seaside, these chaps will soon be as fit as anyone. The Society's patron is Her Majesty Queen Elizabeth, the Queen Mother. She takes a very keen and continued interest in the Society. She has been twice to Benenden, where she goes round and chats to the patients. Many of them she seems to know, and she likes to be kept informed of their progress. She has a smile and an encouraging word for everyone. The Queen Mother is always interested in the latest developments and new installations and keeps in touch with the Society and its work. Her visits are memorable occasions at the hospital, long to be cherished by patients and staff. She obviously enjoys the visits as much as anyone and leaves her good wishes behind when she goes. And now here is Mr. Gordon Loust. He is a patient, the oldest inhabitant, he calls himself. He's been there 10 years. They still cannot find a way to cure him, and he says if they can't, no one can. But he has had 10 extra years of happy life and is still going strong. The hospital is very different today from the first building put up by Charles Garland more than 50 years ago, but it stands as a great tribute to a young man who ended his career in the civil service as a high official. The benefits of the Sanatorium Society are open to all of you. Every employee of the civil service, any department, any grade, temporary or permanent, and to your families and dependents for just a few pennies a week. Take one of the forms which you can get after seeing this film. Study it and join the Society. I hope sincerely that you never need its help, but if you get nothing back for yourselves, you may thank God for that, and you may know that your few coppers have helped to do a wonderful job for those who are not so lucky.